Hey y'all, so this is Rant with a Purpose. Thanks for dialing in again. My name is Bao, and this is my co-host, Dr. Johnson. We're here to rant with you today, and we're going to be talking about meds and just, like our process for what we do when we see a patient. So walk us through a typical, clinic day there, Dr. Johnson.
Sure. Medicines, if you're anything like me, as you get older, you begin to accumulate a list of medicines that you're on, and that list can be overwhelming, confusing. Do I take one in the morning, one at night? Do I take them together? Can I eat with food? All of those things, and it's very confusing. Here at Miriam, it's good to have Bao here with us because we can talk with our patients not just about the importance of medication, but also the importance of being consistent with medications. And we just had a case today that the inconsistency was not just on the patient's part, it was on my part, making sure that I had actually ordered the medication and that the patient felt free enough to call the office and say, "Hey, I'm missing this or I'm missing that," and that was a challenge today.
Yeah, I mean, but it's good. At least we got it resolved. So, what happened was this patient has not been taking meds since December.
Right.
And it's been 3 months or so.
Right.
And we had no idea because nobody, really mentioned anything to us. Don't know what's going on. But apparently, I try to call this pharmacy and there's no answer. They must be really busy. Just ring, nothing. And I think the daughter had mentioned that, they come and all that they get from the pharmacy is that there's no meds here. It's not ready. So it's a lot.
And part of it was also that she had changed pharmacies. And typically in our system, the pharmacies will actually call us and say, "Hey, this patient doesn't have her medicines." So it's a multi-layered loss of misrepresent. Just a mismanagement on several different layers. The patient understanding why she needs her medications, her family understanding that they need to pick them up, me as a physician making sure that I prescribe them to the right pharmacy, and the pharmacy telling me, "Hey, she doesn't have it." Mm-hmm. And so it can go awry in many ways. So medication management can be a complex issue.
Yeah, but I think you handled it pretty well. You do tell patients, "Listen, come back next week. This is your blood pressure. It's pretty high. We're concerned. Come back next week or come back next month. We want to manage you." And when you have that relationship, it's easier, I think, to start, with the medication management. So yeah, with medication management, it's not every drug is alike. I know we had mentioned about missed doses and stuff like that. For the most part, some meds, you can say if you miss a dose, if it's close to, the time that you're supposed to take it next, skip that and then just continue taking, your dose at the next time. Don't double dose. If it's not, so close, if it's within certain hours, like maybe 1 or 2 hours or something. But sometimes in the prescribing information, certain drugs are very different. They have very specific time window of when to take it, and then some are just very generic. So you never know. It just really depends on the drug, that whether you can take it or you skip the dose. But at any rate, if it's something that you're unsure of, or if it's something that's a narrow therapeutic index, which is something that is detrimental, like very important that you take it as prescribed. You don't want to mess around. Always, it doesn't hurt to just call either the pharmacy or the doctor's office. If the pharmacy is like the one we encountered today, that's super busy and they don't answer their phone, obviously, call the doctor's office, talk to the nurse. I would say that's your best bet. I know missed doses is very common. I only currently have a multivitamin and I can't even keep track of that. Like, did I take it this morning? Because when you take it every day, it just all becomes a blur and you think you already took it because you're just so used to that routine. Sometimes it helps also to just have some sort of marker, right? Like just mark down like that day that you took it. I know there's a lot of new high tech devices now that there's even pills where like if you pop it, it knows and it sends signals, but you don't need anything too high tech that relates to your phone or anything like that. I know we like electronics and technology, but even just like a simple calendar, right? And then just mark it off. That way you can be sure. You don't even have to wait until you think you have dementia and you're forgetting stuff. Like, just doesn't matter at any age. Sorry about that. We are quite some busy people with a lot of alarm clocks. But yeah, I mean,
Well, one of the things, all these devices, the Dexcom and the phone reminders. But again, I think the most pertinent thing, and you demonstrated that today, is being able. And pharmacists are so busy. You go to these busy drugstores; they really, unfortunately, don't have the time. And then with the mail order pharmacies, it's going to get even worse. So here at Miriam, you demonstrated that today that we after discussion with the patient about the medications and why we are renewing and why we are changing. We actually changed 3 of our medicines. We stopped one medicine, we changed the dose of another medicine, and we created a new regimen for the third medicine. So she had 3 major changes in her medication.
Yeah.
And then having a family member with her as we told her that we're changing these things. That's very, very important. You don't get that in the usual doctor's office. You don't get that.
Yeah.
Your medicines at the pharmacy, go pick them up. And but having the opportunity to talk with her, and talk with her daughter, and say, this is why we're doing what we're doing. Do you have questions? And then writing that down, because by the time I get out of the office, I forget what the doctor told me.
I completely understand. And then as I'm giving the instruction, I can kind of see she's going to forget it, because it's a lot of instructions we're trying to give these patients because they're complex people. So yeah, I originally was just going to be like, let me just write it down on a index card, right, and then give it to you so you have something. But Dr. Johnson says there's a care plan. We write it down, print it out. It's very make it very legit and legible for patients to understand exactly what we're trying to say. So not only, like because we, either when you do e-scripts or even if you give them a prescription, once you hand it over to the pharmacy, the pharmacy types whatever they need to type and it comes out in the bottle or the prescription that they get. But sometimes the instructions are not always there to a full extent. So the care plan is a perfect way to, we had a dose titration for blood sugar medication, metformin, just because of the tolerance. And, we just have in the history that she just takes one pill of 500 milligrams daily, and that's not sufficient for glucose control. And also, with blood pressure, we were looking and it was very scary number. I won't say the exact number. It's pretty high. That's why we want to see her next week. But, sometimes it's when they come in, you have to say, okay, it's high because you're not taking it. But also, even if they do have the script, you kind of also have to, I would say, probe to say, are you taking it or not every time? I would say just because sometimes it would be controlled and sometimes it would be high. And if I had to make a guess, the high ones are just because we're not taking it rather than, needing additional medications added on to the regimen.
And I think the other thing about this patient in particular, she has missed several of her appointments, which that's her own fault. Now that's a lot of factors. She doesn't drive. She depends upon other family members to bring her to her appointments. And sometimes they're busy or not caring, or however you want to look at it. And so that's another factor in non-compliance. Having said that, we have to get the family members to own the responsibility of, being aware that they have to bring their loved one here to be seen. If you cannot get through to the doctor's office, she says she's called several times. I don't remember getting the calls, but maybe she did. So I have to own the responsibility and say, okay, you called, I missed it. Because there's no sense in me arguing with you about
Yeah.
did you call or did you not call. I say, okay, I missed it. I need to do that, and that gives them the freedom to you know give further information as to why they are not complying.
Mhm.
But you don't want to get into an argument with your doctor about whether it's their fault or not.
Yeah.
As a physician, just own the responsibility and say, hey, how do we move on from here? That's the easiest thing because you're being right doesn't help the matter.
No, I think also just establishing that relationship, that trust, and say, we do care.
Yeah.
We do care about you. Let's move on. How do we um, proceed to keep you healthy and, not walk around with high blood pressure or high blood sugar. Um, just I think just having that empathy, that concern can really show through, and you show it with your patients. Just like with lab work, there wasn't lab work for the last
Yeah,
6 months,
yeah.
and they remember, like, going and getting lab work earlier this year, and we just didn't see anything ordered in the profile, so there's no way that there could have been lab work, but we didn't fight it. We said, okay, well, let's just get another one.
Yeah, let's get another. It's not worth arguing.
Yeah, so
And again, because you want to be approachable. You don't want to be right.
yeah.
I mean, being right means they're wrong, and then that makes them feel bad. Just say, hey, let's move on. And so I missed that, or we missed that, or whatever, but let's do this again. And that, again, patients need to feel freedom and at peace with their provider. If you're at war with your provider, you're with the wrong provider.
Yeah. And also, you get a variety of patient uh, who and their levels of health literacy. So we have a patient like that, and we also have a patient who is very intelligent, a young man who just walked in. He knew he had a problem that he needed fixing, that he couldn't do it on his own, and he's has some sort of scientific knowledge because he works for a small biotech firm, and so like when we prescribed something for him, I didn't want to just say, we're just going to give you an antibiotic, go pick it up and we'll see you soon. I showed him the treatment guidelines. I showed him comorbidity, with smoking, so that way it doesn't look like we're just making stuff up, like, because honestly, smoking and alcohol, you can relate that to pretty much any disease. Like, it affects any and every organ that you can imagine of, inflammatory, like it's all over. So I think having this young fellow, having seen like it written on a website, legitimizes the comorbidity, and hopefully that will be a turnaround to smoking cessation, because it's so important. Like lifestyle changes, that's the first treatment that we should seek, instead of just, let's just prescribe you a pill and treat you.
Again, the team approach. I mean, I'm so glad you're here because the team approach, it's good when this knowledge is layered. So it's not just from the physician, it's also from the pharmacist. These commercials that say, ask your doctor. No, I say, don't ask your doctor. Ask the pharmacist. The pharmacist investigates more thoroughly the interactions because every medicine has an interaction with another medicine. It may be small, it may be unnoticeable, but they all interact. The young lady that we saw that was on these other medicines that have CNS effects and central nervous system effects, as well as analgesics effect. Having that discussion with you about her was just crucial. She wanted something, and I'm saying, well, should I give it? and then being able to discuss it with you and talk about, hey, we can do it, but we've got to do it in a measured lower dose. That's just crucial. So teamwork is just
Yeah.
crucial.
And you do get this. You get this at the VA. You get it at nice locations like well-known hospitals. You get that teamwork
Mm-hmm.
effect. The pharmacists are involved in
Mm-hmm.
ambulatory care clinics.
Mm-hmm.
But if you look at a private practice, you don't see the pharmacists. And
Mm-hmm.
I remember when I was doing rotation as a student back in 2007, um, it was at an AmCare clinic, and
Mm-hmm.
it was somewhere near Roosevelt Boulevard in Philadelphia. And it was very appreciative of the clinician as well. He was very happy. Um, it was through a pharmacist who had worked for retail, but then she brought the students to the clinic. Um, but he had mentioned something that I never really thought about till your conversation here, is that he mentions this is really great, but the affordability to have a pharmacist here is not yet I think caught on in the East Coast. He said in California, like in the West Coast,
Mm-hmm.
it's very easy. It's
Mm-hmm.
it's there, but
Yeah.
East Coast, it's a little bit harder to kind of sell
Yeah.
for clinic practice to pay a pharmacist to do that. Something that's not like teaching hospital related.
Right.
But yeah, it is important because medications are really that front line to
Yeah.
therapy. Yeah.
Well, I mean, again, the uh, hospitalizations and complications of medication errors are real. I don't know what the numbers are.
Oh yes,
Yeah.
I'm pretty sure. Yeah,
Yeah.
they're up there. Polypharmacy,
Yes.
different medications as well. Different prescribers. Different prescribers, maybe prescribing the same type
Mm-hmm.
of medication, and you don't realize it.
Mm-hmm.
And even like upon discharge,
Mm-hmm.
even when you go from one hospital system from an acute care, like if you're inpatient, to a subacute care from the same hospital system, there's still medication error. There's
Mm-hmm.
still that's why you have pharmacists who do medication reconciliations, just to kind of tease all the necessary medications, and really the best way is to interview the patients.
Yeah.
Ask them what they're taking.
Yeah.
Yeah.
So that's the advantage of having you here, and that's the advantage that we have here at Miriam is this teamwork. You know, doing doing the physical diagnosis and doing the physical exam, making the correct diagnosis, ordering the right lab test. That's all part of it. But you can do all of that correct. But if you get the therapy wrong, it all means nothing. And if you give the therapy and if you get therapy wrong, it can be really, really tragic.
Yeah.
And that's why it's crucial.
And like and I get it, like physicians sometimes don't have enough time to sit there and do research because you've got the patients, and then you have to write up your soap notes. And pharmacists, we do have to write notes as well, but for me as a pharmacist, I take it very seriously because I don't take any medication, even if it's just Tylenol or ibuprofen, lightly, because everything you consume has an effect, one way or another. But it's like, do we want the risk of treatment something? Is that better than having the side effects that you're willing to potentially, withstand? So, and then you just kind of come with the mindset, like, do you want to prescribe this to your mother, or do you want to give this to your children? If you don't, why would you be doing it to patients? And I think just having that mindset and just being really careful, and like sometimes like you go to the pharmacy, they are supposed to counsel you on new medications, but it's always decline, that decline form, and sometimes people will decline it for you. But sometimes patient might not even ask because they feel like the doctor might have already given them the information they needed. They don't need to hear from a pharmacist. They may not really see the value of pharmacists, really, just because we don't proactively go out there and talk to people.
Right.
Yeah. I used to follow that rule back when I work in retail because the one chain that I had worked for, their rule was every new medication had to be canceled, even if it's a refill and it's a new prescription. So it's a good practice.
Yeah,
It's like, even if it's a refill, you go and you tell them, like, is this your dose? And then, you never know what they say. They'll say, well, no, because I was supposed to get an increase or a decrease in dose. And then that prompts you to take the script back and then call the doctor's office and, discuss that further. And I've caught a lot of different type of errors, like just not even from the physician, it's just from filling, because you have so many refills of, five, four different refills of the same med, different doses. You never know. So it could happen.
And it's going to get worse. Actually, and I hate to say that, but it's going to get worse. It's going to get worse for several reasons. One, on the physician side, primary care is failing. It's hard to get to see your doctor. It's hard to get an appointment. So you end up going to urgent care or emergency room emergency rooms, which get a list of your medications, but it may not be the current list.
Right.
And so they don't know that you were tapered off of this medicine a week ago, and the urgent cares are just as bad. They're just urgent. And of course, the online and the what do we call it, the internet,
Yeah.
the internet doctors, telemedicine,
Yeah.
and it's getting more and more complicated, which is again why you need a one-on-one, face-to-face encounter with your doctor, and you need it in a setting like Miriam, where we can sit down, we can talk with you about your medicines, and review, because when you get out of the hospital, you've got, or you get discharged with 20 medicines, and stop this one this week and stop this one next week, and it's confusing. And then as you move from one doctor to another doctor, that trail of medicines follows you, but you may not understand. You have a cardiologist, you have your pulmonologist, you have your podiatrist, you have your orthopedist, you got all of these doctors, your endocrinologist. And so you need to be in a setting like Miriam, where we can sit back, look at all your medicines, and review your lab studies, and bring all these things together at one time and discuss it with you, your family. We had the family member here today, and that's the ideal thing.
I have to say, you're very generous with your time.
Yeah.
You would tell folks to come in and review lab, and from my experience, it's just a phone call, right?
Yeah.
Or they'll even just mail them if they don't have internet access to a patient portal. So you're very, very generous. You allow patients to walk in, and that's really the whole purpose of Miriam, is that you allow everybody, and anybody can walk in at any time. So that's the great part of it. But I think folks do recognize the importance of just calling, making sure that we're actually open, for one, and then two, that we spend adequate enough time for you, right? Like we spend enough time for you, but that means someone else is waiting. So that's the importance of making an appointment and making sure that we, give everybody that same equal treatment. But you're just like, you guys are just an open arm, and I think it's amazing. It's just, I don't think I really know anybody else who is this generous with their time, let alone volunteering. You're doing this as a career.
Yeah. Well, what makes it easy is we have enough supporters to cover the costs of this. So I don't have to look for who's paying the rent and all those things I have to worry about. So typical primary care doctor has all of those things to worry about. Well, how much staff, how they're going to pay the, but I have a volunteer like you, my wife volunteers, we have other volunteers. And so that makes it a lot easier.
You're a volunteer.
I'm a volunteer, yeah. So it makes it so when you are dependent upon numbers, I got to see 12 patients today, otherwise I can't make. We don't depend on that. So we see who comes, and it doesn't. Our bottom line is, did we help you? Not how much money we made, how much money. Our bottom line is, did we help you today? And that's what really matters for us.
Yeah. And really, and you, for the most part, your patients know you so well. They know what you do. They're like family, church members. It's just really nice. Like you just have this big circle of a community, and I think folks are just really grateful for someone like you around, because I don't think a lot of communities have that.
Right. Yeah. 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 They don't.
Yeah.
We're fortunate. We're fortunate to have this opportunity.
Absolutely. Absolutely. Yeah. Fortunate on both sides. Yeah. Well, thank you so much, everybody, for listening to us. And that's ranting. And our purpose was, taking your medications and just hopefully you get to develop a relationship with your provider as well, because that's so important.
And be your own advocate. Don't just say, "Hey, doctor." Don't.
Yeah.
If a doctor gets angry with you for answering questions, find another doctor.